The chest wall, this is the ribs. And here is the intercostal spaces. The intercostal spaces, it contains three muscles. The external intercostal muscle, with its fiber directed downwards, forwards, and medially. This muscle is changed into a membrane, which is called the external intercostal membrane or the anterior intercostal membrane, which is apparent here. The rest of the muscles is not very important to know. Like, what's important for us is if I reflect this thoracic cage, I'll find the internal thoracic artery and the internal thoracic vein. This is important because this artery is used clinically for coronary bypass, and its surface anatomy is well known. It is 1 finger breadth lateral to the sternum. It passes behind the costal cartilage, 1 finger breadth from the sternum. This is the internal thoracic artery or the internal mammary artery. If I open this one, I will enter the thoracic cavity. I will find here is the right lung, this is the left lung, and this is the heart covered by the pericardium. I will find the cardiac notch of the left lung. To leave, this is the bare area of the heart, is not covered with the lung. While the right lung covered the right side completely. The left lung leaves the bare area of the heart because this is the cardiac notch and the lingula. The part of the cavity, the chest cavity, between both lungs and pleura, اللي في النص ده هو, this is called the mediastinum, which contain the heart and the great vessels and the trachea and the esophagus. This is the mediastinum. So if I remove this lung, and if I remove that lung, so this is the heart covered by the pericardium, and this is the great vessels arising from it, and this is the superior vena cava entering the heart, and this is the azygous vein entering the superior vena cava. This is the superior vena cava, and this is the azygous vein, which arches from the back and enter the middle of the superior vena cava. This is the phrenic nerve. The right phrenic nerve passes to the diaphragm, and this is the right cupula of the diaphragm. It is bulging because under it is the liver. So the right cupula is more at a higher level than the left cupula, and this is the phrenic nerve, the right phrenic nerve. Related to the pericardium, it lies on the right side of the superior vena cava, on the right side of the right atrium. So it has a venous course, it lies on venous blood. The right vagus, it lies immediately in front of the trachea. It lies immediately in front of the trachea. And this is the left phrenic nerve. Lies on an arterial blood on the left ventricle covered by the pericardium. It supplies also the left cupula of the diaphragm, which lies at a lower level and a right cupula. Stop it. Concerning the trachea. The trachea, this is the larynx. The trachea starts where the larynx ends, at the level of cervical 6, or at the level of the cricoid cartilage of the larynx. And the trachea passes into the neck, and then in the superior mediastinum, where it ends here. This is the trachea with its rings. It ends at the level of the sternal angle, or the angle of Lewis, or the lower border of thoracic 4, by giving the left main bronchus and the right main bronchus. In the neck, the trachea, you'll find this is the thyroid gland. This is the thyroid gland lies and the isthmus. The isthmus lies in front of the trachea, where the thyroid lobe lies lateral to the trachea, because this is the trachea. So this is the trachea. The isthmus of the thyroid gland lies in front of it, and each lobe lies on the lateral side of the gland. And also you'll find the carotid sheath. Posterolateral to the trachea. So the main relation of the trachea in the neck is, in front of it is the isthmus. Isthmus, which connect the two lobes of the gland. It lies in front of trachea ring number 2, 3, and 4. Lateral to the trachea, I'll find the thyroid lobe and the carotid sheath, which contain the carotid artery and the internal jugular vein and the vagus nerve. This is the carotid sheath. Concerning the thoracic part, I'll find this is the trachea. To the left of it, I'll find the arch of the aorta. This is the arch of the aorta. The arch of the aorta starts in front of it and then becomes to the left side. On the right side also, I'll find the azygos arch. And this is the azygos vein. And then the arch arches over the hilum of the right lung to reach the back of the superior vena cava. So to the left of the trachea, there is the aortic arch, and to the right of the trachea, the azygos arch. حش أحسن من حد. In front of the trachea بلاقي فيه vein ضخمة. This is the left brachiocephalic vein, crossing in front of the trachea obliquely to join the right brachiocephalic vein to form the superior vena cava. And this is the azygos vein. If we look to the arch of the aorta, it gives the 3 main branches. The arch of the aorta gives the brachiocephalic artery, which lies in front and then to the right side of the trachea. And it gives the left common carotid artery to the left of the trachea, and the left subclavian artery, which is away from the trachea. The arch is crossed by 2 nerves. This is the vagus nerve, the left vagus, crossing the arch of the aorta. And while it's crossing it, it gives a branch, which this one. This is the left recurrent laryngeal nerve. This is the left recurrent laryngeal nerve. From this left vagus, this is the left recurrent laryngeal nerve, which hooks around the arch and ascend between the trachea and the esophagus. This is the left recurrent laryngeal nerve. There is no right in the thorax. Behind the trachea, this is the trachea, lies the esophagus. Behind the trachea lies the esophagus. And in between them, the left recurrent laryngeal nerve. This is the right main bronchus, shorter. This is the left main bronchus, longer. The right, wider. The left, narrower. The right is in more line with trachea, but the left forms an angle with the trachea. The right divides into 2 bronchi before it enters the lung. Like this divides only inside the lung, giving 2 main bronchus. Like it gives the upper lobe, the superior lobar bronchus, and the inferior lobar bronchus before it enters the hilum. This is why in the hilum of the right lung I will find 2 bronchi. Behind the trachea, this is the esophagus. Attached to the diaphragm here is the right the right phrenic nerve. Reaches the diaphragm on the right side, so this is the right phrenic nerve. The right vagus nerve, it lies immediately in front of the trachea, on the right side of the trachea. The right vagus nerve, it lies immediately to the right side of the trachea. So this is the right vagus, and this is the right phrenic. Phrenic رايح للdiaphragm. And this is the left vagus, because it passes to the esophagus and not reaches the diaphragm. This is the left vagus nerve. Behind it, there is the left phrenic nerve, and I think it is cut. The left phrenic nerve, it crosses also the side of the aortic arch. So the vagus, and this is the phrenic nerve. The left phrenic nerve. And this is the diaphragm. The diaphragm. And this diaphragm separates the abdomen from the thorax. On its upper surface attached the pericardium, which covers the heart. And this is the pericardium. And this is attached to the central tendon of the diaphragm, and it is pierced by an opening of the inferior vena cava. The inferior vena cava has to open the diaphragm, has to open the pericardium to reach the right atrium. From the abdomen, as you know, the origin of the diaphragm, it arises by two crura, reglain, the right crust of the diaphragm and the left crust of the diaphragm. Left crust of the diaphragm, right crust of the diaphragm. And this is the central tendon of the diaphragm. And this is the aortic opening, where the abdominal or thoracic aorta descends through it. And this is the caval opening for the inferior vena cava to enter. And the third one is the esophageal opening, opening for the esophagus. This opening for the esophagus. It is not a clear suprarenal gland. It is not a clear specimen. But this is the diaphragm. And on the left side, left crust of the diaphragm. On the right crust of the diaphragm. It is not clear specimen. It's a very bad specimen. And this is the pericardium attached to the central tendon of the diaphragm. This is the trachea. And this is the right phrenic nerve. On the right side of the trachea is the right vagus nerve. And this is the azygous vein entering into the superior vena cava. And this is the arch of the aorta. The trachea, behind the trachea is the esophagus. This is the left vagus nerve, giving the left recurrent laryngeal nerve, which hooks around the arch of the aorta. The arch, it passes from front backwards and passes upwards between the trachea and the esophagus. Stop it.